Yes, August is Immunization Awareness Month. Today we will be discussing diphtheria and other preventable diseases killing Nigerians because we do not take immunizations very seriously. Joining us to discuss the main causes, symptoms, and treatment is the infectious disease expert himself, Dr. Japhet Olugbogi in the building.
Yo.
For those of you that don't know Dr. Japhet, he was very prominent during COVID. And he was looking very scruffy. Fast forward now. Like, you are looking on point and everything.
Okay, well. You guys were taking me out of my house 5 a.m. every day for 3 months and tops.
But you cleaned up. Lagos is doing you well.
Yeah.
Lagos is really doing you well. I'm happy
Lagos
you've not
is the place.
You've not jackpot. Please don't jackpot. Just be shiny like this.
Well, you have to motivate me.
Motivate you. Anyway, let's
you now.
Diphtheria. I mean, we've been hearing about it, reading about it in the papers for some time now. Tell us what it is exactly, because many people don't even know what it is. We've just been seeing diphtheria in the papers. What is it?
Diphtheria is a bacterial disease. It's a very infectious disease. They call it Corynebacterium diphtheriae. It's a disease of the respiratory tract. Respiratory tract is the nose, the throat, the trachea, and all that. And so it comes from someone who is infected through sneezing and coughing. We call that droplet infection. So when someone who has diphtheria coughs or sneezes, they emit the bacteria onto other people, especially children. It's commoner in children between 2 and 14 years. Although adolescents above 14 years can also have it, or even adults, but it's commoner within that age group. People can also contract it through direct contact with someone who has it, or through in the hospital when they are taking care of someone who has it, or in the homes where we have people who are sick and they are being taken care of by their family members. So diphtheria, respiratory tract infectious disease, communicable disease, Corynebacterium diphtheriae. Although there are other strains of that bacteria, but the one that causes the problem is the one called Corynebacterium diphtheriae.
I mean, just very recently, we've been hearing all sorts of alarming stories coming out of children who are dying or in hospital because of diphtheria. And as far as I know, it's supposed to be one of the immunizations you get even free from government hospitals. What has caused these numbers to grow, and why do we have like a new infection, a wave of this diphtheria recently?
Well, thank you very much. The COVID-19 pandemic, it can be, likened to that, because during the COVID-19 pandemic, there was lockdown. A lot of children could not go to the hospitals. A lot of parents could not take their children to the hospital. So they were denied access to routine immunization. And of course, like you rightly mentioned, diphtheria is one of the preventable diseases with routine immunization. So because these children could not have access to routine immunization, we have a low coverage of routine immunization in Nigeria nationally. Of course, it's all over the world, but of course, sub-Saharan Africa is usually the hotspot for this kind of troubles when we have low coverage of routine immunization. So undernourishment as well, when children don't get enough to eat, we have internally displaced people in Nigeria, a lot of activities due to, banditry and all that. So we have a lot of children in Nigeria. I think WHO pegs it to about 6.2 million children between 2019 and now who lack access to routine immunization. And this is one of the cogent reasons why we are having an upsurge of routine diseases that ought to have been prevented by immunization.
So 2020 to now is just 3 years. So if the kids have had their immunization before and they are put in contact with someone who has diphtheria or someone who has it sneezes on them, will they catch it?
Well, what happens with diphtheria is that even some children who have had their immunization, can still have diphtheria because the bacteria is there. Human beings are the only host to the bacteria. So the bacteria is like a commensal, that is something that lives there. But when they start releasing toxins, and that happens when our immunization is not up to date. And let's not forget that the immunization may even be there and not complete. The full dosage ought to be 3 dosages at 6, 10, and 14 weeks. But we ought to give those children a booster dose after every 10 years. Yes, so they may be fully vaccinated. They may be vaccinated and not fully vaccinated. They may even be fully vaccinated and still have the infection. But then again, the people who are fully vaccinated have a high, opportunity to ward off the infection.
So you say after 10 years, do you mean that me too, I should have been taken every 10 years?
God, why saying that?
It's assumed that as an adult, your immune system, your immune level is, very high, compared to children. So we should think that you have some form of immunity against it, compared to children.
Because when you say 10 years, it's 10 years, then the next 10 years is 20.
Yes, of course, you should get a booster dose. But I suppose you should have gotten the booster dose because it's in the, it's in the TB vaccine. That
you mean as a child?
Pregnant women. So we give pregnant women 5 doses of TB vaccine. So you should have gotten your own booster dose in that. So you should be covered. It's children that I worry about. Fantastic question. Men don't have that opportunity, especially in Nigeria, because we don't have that TB vaccine designed for them. Because, when they want to prioritize some of these vaccines, they prioritize those who are most vulnerable to that particular disease. So women who are pregnant, attend antenatal care visits, get their TB vaccines, they get their shots of TB vaccines, but men don't get that. So men are vulnerable to it. And then I remember earlier on in the year when we went for this diphtheria surveillance and outbreak national guideline review, it was one of the things we recommended that men, especially those who are health workers, those who are prone or could be prone to getting the infection, should be allowed to have some form of booster dose against diphtheria.
Okay.
Interesting. When we take these stories, we wonder, we hear the spread. What would you feel is the best line of action to curb the spread? Are there states where there's no diphtheria, and how can they ensure that it doesn't get into their states?
Yes, of course, there are states where there's no diphtheria because it's only in about 3 LGAs in the country. And, there are about 8 states where we have the highest burden of the diphtheria outbreak, although FCT and Cross River are being reported to have joined them now. So there are other states that don't have the outbreak yet. And right now, they should be sensitizing, just like we are doing now. They should be sensitizing, holding stakeholders, community engagement, activating their SMCs, their social mobilization committees, to create the awareness to the people so that those who are hesitant and skeptical about taking vaccines for their children can go ahead and ensure that they get vaccines for their children, because it is actually preventable. If children could be vaccinated, 3 doses of the vaccines at 6, 10, and 14 weeks, it could actually be prevented. But I'm aware that right now, the NPA-CDA, in collaboration with states executive primary care boards, are organizing some form of catch-up immunization activity. And this will enable children that have missed out on the vaccines to be able to get their vaccines, and the pentavalent, which is the vaccine that contains the diphtheria vaccines, is one of the antigens they are being given. This is organized like an outreach. That is, they are taking it to where people live, where people reside, in markets, in shops, in churches, in mosques, and all that. So this is one of the strategies that are being rolled out to ensure that the outbreak does not spread further to other states or even further within a particular state.
I have a question from our YouTube viewers. Somebody was asking that you should talk about the fact that they're assuming that the reason diphtheria is high in Kano, Kaduna is because they refuse to take the immunization as opposed to COVID. Is an allegation. They also asked that you should talk about the newfound strain of COVID in the UK and what the implication might be for us in Nigeria.
In the northern part of the country, we've always had vaccine hesitancy.
Yeah.
And it's a big problem. I'm aware that the government has done a lot, talking to traditional rulers, community, and doing community engagement, talking to influencers in the communities to ensure that people bring their children out to the health centers or they allow those who are taking the vaccines to their homes. So it's a huge problem, but of course it's not limited to the north alone. We still have vaccine hesitancy even here in Lagos.
Indeed.
There are people, there are people who do not want to give the vaccines to their children for one reason or the other. I think one thing we should be saying to people is that these vaccines are safe and they're being given to Nigeria by partners. Nigeria also doing its part to ensure that her children are, vaccinated and protected against diseases that ought not, kill children in the first place. So we should encourage our neighbors, our friends, our wives, our, in-laws, whatever, to ensure that they take their children to the various PHCs to vaccinate children. As per the new strain, of course, we always have new strains in bacteria, new strains in viruses, and, the COVID-19 example is still very rife in our memories, and, I believe that the healthcare systems all over the world are now prepared to deal with all sorts of new strains of bacteria, of viruses that may spring up, and that is why they've tagged them now as emerging diseases and re-emerging infectious diseases.
Okay, any questions on social media?
So, yeah, of course, there's the social media people, they are asking that why the men in medicine, they should be working more on how to develop the vaccines for men. Someone is asking, what do you look forward to with the Minister for Health and the work that you expect them to do?
Yes, it's true. We should.
Yes, to correct the notion, there's actually vaccine for men, which is the Tdap and DTaP. But what we should be saying is that we should make it available. I'm not quite sure we have that Tdap in the country as we speak. We should make it available for men to have access to it. But then again, it's all about funding and finances. What we look forward,
soldiers, you don't
yes, what we look forward to from the new Minister of Health, well, it's an erudite professor. It's someone who has the expertise to do what is needed. I would personally like to see a more reformed health sector in Nigeria, not just funded, but reorganize and ensure that things are in place where they ought to be in place. I think that if we can do that, we can improve our health systems, because the building blocks of the health systems in the first place are financing, the workforce, the leadership, policy, governance, and all that. So if we can get all those right, I'm sure we can move the healthcare setup.
So is there a treatment for if you catch this disease? Is there a treatment and a permanent treatment, curable? Is it life-threatening?
Diphtheria is life-threatening. The case fatality ratio, that is, if 10 people have it, at least one of them may die from. Yes. So the case fatality ratio is about 10%, but it's treatable, absolutely treatable. Okay. There is the diphtheria antitoxin, which can be used to treat it, which is very good to treat it. There's also antibiotics. The physicians have antibiotics that they can use to treat, and they're often effective if the cases are caught on time, and if the children who have this diphtheria are taken to where they ought to get treatment on time.
I'm happy, sorry, Miriam.
okay, it's fine.
I'm happy you mentioned antibiotics because in the Western world, I'll talk about England because my grandkids are there, they do not like to prescribe antibiotics to children, even adults, you know. But here, we seem to prescribe antibiotics all the time. And a lot of times when they even prescribe antibiotics, they will give you probiotics as well because antibiotics are actually killing some cells in the... Why is that?
There are some instances where you can do what we call watchful waiting when someone has an infection. Watchful waiting in the sense that if it's not so bad, you give supportive treatment like paracetamol, ensure the person is well hydrated, ensure the person has other things that the person needs. So when you do that watchful waiting, the body can take over and win over the infection. But most times when it comes to bacteria, you have to give an antibiotics. And the treatment in diphtheria I'm talking about is not some form of antibiotic that they will give the mother, oh, yeah, take home and go and take. No. They will administer it in the hospital. So if a child has diphtheria in the UK, I am quite sure they're going to administer the 8 years or administer antibiotics.
So, you know, you talked about them being highly infectious, and I was wondering, during what period are they most infectious? When they're on treatment, can they still infect someone else? Person caring for them, can that person still?
A fantastic question. When someone who has diphtheria, when a child who has diphtheria has been on antibiotics for about 48 hours, they should no longer infect other people anymore.
Okay.
By that time, the infection is a bit docile.
Fortunately, we have to wrap up. Thank you very much. Always a pleasure having you, Doctor, here with us.
Thank you for having me too.
That's all we can take on today's show. Have a great day. We'll see you tomorrow. Bye for now.